So we're going to talk about red spots on the skin. I had someone ask the question, and there's basically about 3 or 4 different underlying causes to this. And it can be any type of shape or size, but usually it's this red little area in the skin. And there's various medical terms for it, which I don't want to get into. I just want to talk about what it could be as an underlying root cause. Now, when you're deficient in vitamin K1, you're not going to be able to clot that well. So you're going to get bruising. And whether it's red or purple, you're going to have these little bruises on your body, and that could be the reason. You can also be deficient in vitamin C because vitamin C controls capillary strength. So if you have a deficiency of vitamin C, you're going to get the red spots are going to look a little bit different. They might look like spider veins or little pockets of this red or purple color, because you need vitamin C to strengthen the capillaries, which are the vascular system just underneath the skin. So it could be either vitamin K1 or vitamin C. But in nature, vitamin K1 and vitamin C usually come together as a complex. So if you're consuming vegetables, you're going to get a mixture of both of them. Also, your gut makes K1. So if you have a history of antibiotics, then it could be the reason why you're deficient. Your body just is not making it. So we have vitamin K1 as a possibility, vitamin K1 deficiency, vitamin C deficiency, but you could also have low amounts of calcium. Low calcium will also cause the red spots on the skin. It's very rare to have this happen, but it could happen. So low calcium could be one cause. Another cause would be a viral infection. Okay? Now, there's other causes as well. Like if you have diabetes or some type of chronic metabolic problem, you're going to see red spots on the lower extremity, right by your lower legs, almost like a large blisters or bruising, purple or red. That's just poor circulation. But typically, most people have these red spots because they're either not consuming enough of these right here to get these nutrients, or they have some type of malabsorption. They're not able to absorb it because their gut has inflammation or it's damaged from antibiotics, or they had gastric bypass, or they have a fatty liver, which will inhibit the function of vitamin K1, because a lot of the fat-soluble vitamins are stored in the liver. So if you have gallbladder problems, lack of bile, you had your gallbladder out, you're not going to have the bile to absorb this fat-soluble vitamin, and that could be the reason why you have these red spots. A gastric bypass could also create a deficiency of both of these because it alters the stomach and the gut. Now, in some circumstances, if you add some bile salts to the diet, you can find that you get a lot more absorption of all the fat-soluble vitamins, including K1. So it can help your clotting factors. Now, the foods that are high in K1, kale would be at the top of the list, spinach, collard greens, just dark leafy greens in general. And by the way, all of these are loaded with vitamin C. Sauerkraut has the most vitamin C, like 700 milligrams per cup. Bell peppers are loaded with vitamin C. Other peppers have a lot of vitamin C. Berries have vitamin C. Lemons have vitamin C unless it's pasteurized in a container. If you get raw lemons and you take the lemon juice, then you have vitamin C. If you get it in a glass jar, it's pasteurized and you have very low levels of vitamin C. All right, so that's my summary on red spots on your skin. Before you go, if you have a question about a product, or you're new to keto and you want to know how to begin keto, or you're on keto and you need a debug because it's not going as smooth, I have a keto consultant standing by to help you. This is just for the people in the US. Hopefully in the future we'll be able to answer everyone's call, but I put the number down below so you can call and get some help.